Hello guys, welcome to my YouTube channel. Myself Avti Almas from KT Patil College of Pharmacy, Usmanabad. Today we are discuss about anti-anginal drugs. Firstly, we have to know about hot points we will to be discussed. Let us start it. Content: Angina pectoris, types of angina, anti-anginal drugs, classification. We are deeply seen the nitrates, beta blockers, calcium channel blockers, and potassium channel openers. First of all, we have to know about angina pectoris. Let us see. It is a chest pain or discomfort due to coronary heart disease. It occurs when the heart muscles doesn't get as much as blood. The common cause is blockage somewhere in coronary arteries that supply blood to the heart. In that above figure, see the blockage of artery. Next point is types of angina pectoris. There are three types of angina. First one is stable angina, second one is unstable angina, and third one is variant angina. Stable angina. Stable angina is also called as classic or typical angina. It is caused by reduction of coronary perfusion due to fixed obstruction of coronary artery. Attacks are predictably provoked by exercise, emotions, and eating. When the physical activity increases, greater in oxygen demand. Next one is variant angina. Variant angina is also called as vasoplastic angina, in that attacks occurs at rest or during sleep and are unpredictable due to recurrent localized coronary vasospasm, which may be superimposed on atherosclerosis coronary artery disease. Next one is unstable angina. Unstable angina, in that rapid increase in duration and severity of attacks due to rupture of atheromatous plug, attracting platelet deposition and progressive occlusion of coronary artery. In that slide, rupture of plug causes platelet deposition and resulting in incomplete occlusion of coronary artery. So, in that representation, you can understood the conditions in types of angina. So, here in this peak, you can see the normal conditions of blood vessels. This is the normal diameter of healthy blood vessels. This is the conducting vessel and this is the resistance vessel. The exercise done by the individual, there is increase in the dilation of vessels. You can see the dilated here and dilated here. Now, what happens in classical angina? Let us see. In that classical angina, these blood vessels are affected by atheroma. Atheroma undergoes atherosclerosis chain. Because of this atheroma, partial blockage of vessels. So, here you can see because of atheroma, these blood vessels is partially blocked. When exercise is done, that is dilation of blood vessels, but because of the presence of atheroma, there is blockage of blood vessels. So this lead to anginal attack. Because of presence of atheroma, blood can't flow to the myocardium. Okay, let us see variant angina. Now in variant angina, there is spasm of blood vessels, resulting into decreased blood flow. Next point is classification of nitrates. Let us see. First one is nitrates. There are two types, short acting, example glyceryl trinitrate. Second one is long acting, example isosorbitol dinitrate, isosorbitol mononitrate, and erythritol tetranitrate. Second one is beta blockers, example propranolol, metoprolol, atenolol, and others. Next one is calcium channel blockers. First one is phenylalkylamine, example verapamil. Benzothiazepines, example diltiazem. Third one is dihydropyridines, example nifedipine, felodipine, nimodipine, lacidipine and benidipine. Next one is potassium channel openers, example nicorandil. And last one is others, example dipyridamole, trimethazidine, ranolazine, oxyfedrine. Next point is nitrites. Let us see the mechanism action of nitrites. They are directly act on smooth muscles of body and relax them. Nitrates releases nitric oxide, which is powerful muscle relaxant, most predominant in the vascular smooth muscles, that is walls of arteries and veins. Next. Now this slide represents the mechanism action of nitrates. Let us see. Nitrates get denitrated in the smooth muscles. Now when the nitrates get denitrated in the smooth muscles, they release nitric oxide. The nitric oxide is responsible for vasodilation. Nitric oxide is responsible for vasodilation. Nitric acid activates guanine cyclase. This guanine cyclase converts GTP into cyclic GMP, and that cyclic GMP responsible for dephosphorylation of MLCK. MLCK means myosin light chain kinase, and there is inactivation of myosin. Since the myosin fails to interact with actin, and there is inhibition of contraction. That is, there is relaxation of vascular smooth muscles. That is vasodilation. Now, vasodilation of veins is responsible for fall in the venous return, that is responsible for the fall in preload and dilation of arteries and arterioles, responsible for the fall in peripheral resistance and slight fall in afterload. So, nitrites reduces preload, afterload, load on the heart and myocardial oxygen demand. Next one is pharmacological action of nitrites. Let us see the pharmacological action of nitrites. The pharmacological action of nitrites are in 4 stages. First one is preload reduction, second one is afterload reduction, third one is redistribution of coronary flow, and last one is effect on other smooth muscles. Preload reduction. Let us see. Nitroglycerin relaxes vascular smooth muscles and dilates both arterial and venous vessels. That causes dilation of veins is more predominant than dilation of arteries, resulting in peripheral pooling of blood and decreased venous return. That results in decreased preload. Next point is afterload reduction. In that, nitrates are also produces arteriolar dilation that causes decrease in peripheral resistance and result in reduction of afterload. Next point is redistribution of coronary flow. In that, dilation of coronary arteries that result in increases blood supply to the myocardium. Next point, effect on other smooth muscles. Relax the bronchi, biliary tract and esophagus muscles. Also dilates the cutaneous vessels and meningeal vessels. Let us see the uses of nitrites. First one is angina pectoris. In that, GTN produces relief within 3 minutes, 75% patients. The rest may require another dose or take longer, up to 9 minutes. Second one, acute coronary syndrome. In that, nitrates are useful by decreasing preload as well as by increasing coronary flow. Next one, myocardial infarction. GTN is frequently used during evolving myocardial infarction with the aim of relieving chest pain, pulmonary congestion, and limiting the area of necrosis by favorably altering oxygen balance in the marginal partially ischemic zone. Fourth one is biliary colic. Fifth one is esophageal spasm. Next one is CHF and acute LVF. In that, nitrates afford relief by venous pooling of blood and reduced venous return, that is preload, and increased end diastolic volume, that is improvement in the left ventricular function. Seventh one is cyanide poisoning. In that, nitrates generate methemoglobin, which has high affinity of cyanide radical and forms cyanomethaglobin. Let us see the mechanism action of beta blockers. In that, beta blockers decreases coronary supply and decreases the rate by blocking beta receptor that decreases the work of heart and decreases the oxygen consumption and resulting in increases the redistribution of blood. Next point is calcium channel blockers. In that, calcium channel blockers block the entry of calcium ions into the smooth muscles and cardiac muscles that decreases intracellular calcium and smooth muscles relaxation and results in cardiac depression and vasodilation. Let us see the mechanism action of potassium channel openers. In that, potassium channel openers opens the ATP sensitive calcium channel. Because of opening of ATP sensitive calcium channel, there is influx of potassium. Potassium move out of the cell, and since the potassium move out of the cell, there is hypopolarization of vascular smooth muscles. This is responsible for the vasodilation. It results in the smooth muscle relaxation. Thank you. Thanks for watching my video. Please like, comment, share and subscribe my channel. Thank you. Thank you again.